You might have seen this news about the waiting times for gynecological appointments and procedures. As a gynecologist and as a woman, I understand how stressful it can be to be waiting to see a specialist for really debilitating symptoms and how difficult it must be dealing with the uncertainties. So thankfully, there's a lot being done both nationally and locally to try and solve this problem. So for fertility patients, while you're waiting for appointment to see a fertility specialist, there are lots of things that you can do to make your waiting time purposeful, and I'll be going through that in this video. The first thing you should do is to try and stay informed by educating yourself about anything to do with fertility. It could be about the menstrual cycle, ovulation, about things that affect fertility in general. I advise you go to the NHS Patient Information website, or you can also go to the HFEA, which is the governing body of fertility treatment in the UK. Another thing you could do during this time is to try and, of course, keep healthy. It's important to make sure that you're eating the right kinds of foods to improve your fertility, and also that you're on the correct types of multivitamins, notably folic acid, vitamin D, vitamin E, zinc, omega-3 fatty acids, and many other minerals. The other thing you could do during this time is to actually track your menstrual cycle and your ovulation. We've said in fertility that one of the things that's very important is your menstrual cycle. So keeping an eye on your menstrual cycle during this time, and actually keeping a menstrual diary, or just download one of the many apps. Now this helps to do a couple of things. Number one, it helps us to have a record of your menstrual cycle, and this is irrespective of whether you have regular or irregular periods. This will come in handy when you go for your fertility appointment and you're being asked about your menstrual cycle. The second reason to keep your menstrual cycle history is to actually have an idea of when your ovulation happens and what your fertile period is, so you can maximize trying to get pregnant during that time. You could also try some home testing, like the ovulation test kits, which I have discussed in a previous video of how to use it effectively. Another thing you could be doing while you're waiting for your fertility appointment is making sure you take care of your emotional and mental health and well-being. Now, infertility and the fertility journey itself is a very daunting and emotional process. And so oftentimes you need some support. And so you can think about different ways of easing the emotional tension and mental health issues, either by joining therapy, practicing some mindfulness exercises, and also joining support groups. Another thing is actually making sure that your GP has referred you to be seen by a fertility specialist. And make sure you do all the investigations that GPs ask you to do. These are usually required during your fertility consultation. And the added advantage here is that if you're found to be rubella non-immune, you can actually have your rubella vaccination even before you're seen by the fertility specialist. The other way of preparing for your fertility consultation is actually making sure that you're eligible for NHS-funded treatment. So this would include researching about eligibility criteria in your area and trying to optimize yourself for that eligibility criteria. All of these things would reduce the delays in starting your treatment and makes you eligible for NHS funded treatment. During this time, you should also prepare financially, because even if you're eligible for NHS funded treatment, we all are aware that sadly, most times you need multiple cycles of a particular treatment for it to be successful. And sometimes not all of these cycles are covered by the NHS. And so it's important for you to be financially ready in case you need to pay for some of your treatments. Another thing you could do during this time is to think about creating a fertility journal. So this could include things like what you've done so far to aid your fertility journey, your tracking of your cycle, the use of ovulation testing, any information you've learned about fertility and the possible causes of infertility. It could also include the challenges you're going through, any investigations you've carried out, any treatments you've attempted. And it's just a way of keeping track of what's been happening. And the advantage of this is that it could be a very good record to discuss with your fertility specialist during your appointment. And it's also a way to bond with your partner. And it's like a record of your journey to parenthood. If you've enjoyed this video, follow me for more tips. And please comment down below about things that you are doing while waiting for your fertility appointment.